Okay. There I am right there. Hello, Loida. You are the first in our chat room. Welcome. Nice to see you there. Let me know where you guys are from, as I'm going to recognize many of your names. But today we got a fun program. Just bear with me. Hopefully that we're going to come through and we're not going to get that echo sound we're still experiencing. Random, Raymond, Beauty, Sam Love, Mazauda, Loida, Catherine, nice to have you here from Malaysia. Beautiful, beautiful thing. Today we're going to touch on something very important. Justin, hello Justin. Nice to see you here. Beauty from New Orleans. Let's go ahead and take this disclaimer off. And we're going to talk about today a very common thing for people that spend a lot of time. Hello, Rob from Australia. Green Bay, Wisconsin. Justin from, Texas. Saudi Arabia, HHH. Hello there, my friend. Mr. Tark from Venezuela. Boy, we're really covering a lot of countries today. How you doing there, Justin? Anyways, we're going to talk about something very important. And by the way, guys, if I get any echoing, I'm going to kind of look back periodically. I've been having some issues here, and I don't think it's me. I think it's OBS system with YouTube, because our programs are smooth, and all of a sudden we get a bad echo in the middle of it. So please let me know, and I would really appreciate that. S. Oak from Pennsylvania. Let's go into a couple important things, and this is going to be an interesting topic. We talk about the psoas muscle. Now, look at this muscle right here. The psoas muscle, let's come on over to this one, attaches basically to the lower T12 region as well as the lumbar region. This is the most common muscle that's being affected, particularly because we spend so much time in a seated position. And the biggest factor when it comes down to back pain and hip pain, it's this muscle. And I'm going to explain why. Christina from Canada, nice to have you here. Anterior in the house. Demetrius, beautiful. Angie from CO, Iora, CO, Australia, Maria. Wow, that's nice. Let's go ahead and talk about this briefly. A number of problems occur in the lower back area. We call lower back pain sacroiliac pain, hip pain, as a result of this contracted psoas. A lot of people out there who have herniated discs, lower lumbar discs, disc degeneration, even conditions into the knee. Women with menstruation problems, pain, digestive problems are all related to this one particular muscle called the psoas muscle. The list can go on from these biomechanical problems, because when this muscle is thrown off, it causes a leg length inequality when people have one pelvic sitting in the higher than the other. And I'm going to really share something with you guys that you're going to be blown away. Some interesting things about this particular muscle. Number one, it's 16 inches long. It's the largest, thickest muscle in the body. In animals, it's known as the tenderloin. This is what you eat. The tenderloin is that psoas muscle. It's a powerful muscle. It runs from the lower mid-spine, beginning at the 12th thoracic vertebrae. Let's see if we can get our little guy out here. Okay. So it runs from the lower thoracic vertebrae, the 12th thoracic, and it goes, connects to all the vertebral bodies and the discs here. It goes into the transverse processes, which is out here, and it goes all the way down the lumbar spine, attaches into the leg. All the way inside, you can see it attaches into the leg area, which would be down in here. This particular muscle is the big problem because we spend so much time in a seated position that this muscle contracts. And when it contracts, it shortens. And when it shortens, it limits so many things. Now, we look at the function. The main function of the psoas muscle, this is our hip flexor. This is what actually brings our knee up. So if you're going to go ahead and bring the knee up, hello, Bronze from Port St. Lucie. You are the closest to me here. We are here. Oh, wow, Kevin from China. That's beautiful. By the way, Braz, you are pretty close to me. I'm in South Florida here. Thank you, Justin. Anyways, this muscle obviously is what lifts our leg up. When we sit, the problem is that this muscle is always shortened because our leg is up and the muscle becomes extremely tight. This causes a lot of imbalances, particularly when we think of smooth elegant, graceful movements like a dancer or athletes. We look at the psoas muscle as one of the most functional and optimal muscle there is in the body. Hi, Angie from Colorado. And so this muscle is what maintains the dynamically neutral orientation that allows us structurally to have a lot of balance down in our lower extremities. The problem here is that the psoas muscle, as we talked about, when we sit for so long periods of time, and most of us are right now sitting. Hey, Matthew from Hawaii. Blessings, my friend. This causes tremendous stress in the pelvic area, and I'm going to show you in just a second. Rotated pelvis. Had big Trini from, let's see, from Trinidad. Beautiful. Anyways, we develop trigger points. We get pain in the abdominal area. And by the way, the psoas muscle, and I'm going to kind of move around here. If you look at that area, it's not real clear here, but you have the iliacus muscle. The psoas and the iliacus come together and form the hip flexor, but we're mainly concerned today about that psoas muscle. So I want to be real precise. Again, you can see the psoas muscle again attaching from the lower lumbar up throughout the lumbar vertebrae, attaching to the bodies, down into that hip joint, and that is the big thing. Now, frequently, this causes pains and compensation throughout the pelvis. A lot of conditions, and I've had numerous people go to neurosurgeons, neurologists, orthopedists. They say, wow, you have a herniated disc. It's coming from tight psoas. Look at all the contraction that you do. And I'm going to show you something pretty cool in just a second, so just bear with me. But I'm going to show you a couple important stretches I think that are very important. I'm actually going to show you a little bit about, we talk about anterior pelvic tilt. Now that's a big topic. People out there, anterior pelvic tilt. Now what happens is, look at that psoas muscle. That psoas muscle shortens. And as that psoas muscle shortens, it causes a hyperlordosis in that area of the lower lumbar spine. It causes the pelvic to shift forward. It causes the tight, obviously that tight psoas, this causes that rotation of the pelvis. Now look over here. If you look here and you see this hyperlordosis, look at that shortened psoas. Look at the normal spine to the left, okay? And let's get in here. And look how that lordotic spine, okay, right here, this lordotic spine goes anterior. In other words, we just have increased lordosis. Now, the anterior pelvis, people who, how do you tell? Well, number one, you have an increased sway back in the lower back. It increases more stress on the discs, which can lead to bulging disc, herniated disc, disc degeneration, sacroiliac problems, and I'll get into a few of your questions after. Sacroiliac, by the way, motivational doc, go to my Facebook channel. You want to send questions? Easier than my email. Motivational doc, go to my fan page and like my fan page. And yes, that would be the best way. Daphne from Gotham, how are you? Yeah, we'll be right with you. I know we got lots of questions. But increased lordosis in the lumbar spine affects the sacroiliac joints as a result of that contracted psoas muscle. Now, in order to know that you have a forward pelvis, you can see that people that usually stand up have a big butt. Their butt sticks out. That is usually an anterior pelvic area. That is quite common, the hyperlordosis there. Here we can see when the pelvic, how it goes forward. Look at the first picture right there on the left, and look at the second picture on the right. Look at the pelvic go forward. Look at the increased lordosis, and that leads to a lot of back problems, a lot of inflammation, a lot of irritation on the discs, and that is something that needs to be corrected. Now, people out there, I want to show you some important stretches, very important stretches about this psoas muscle, but I also want to stress something very important to you. Let me see if I can get rid of this. People that spend a lot of time, okay, what is this, a warrior position? Those people that do yoga, right? That warrior one, I believe it is. Excellent stretch for the psoas muscles. You see that front leg, how it's bending down, and that back leg is just stretching back. Well, that back leg, as it's stretching, is really stretching that psoas muscle. Look over here in this picture here. You can see another great stretch is when we just flex and we put that back knee down and we kind of go forward. we are really stretching that psoas muscle. See that little arrow up on that back leg of that skeleton up there? That is stretching the psoas muscle. That is something that you guys need to do. But one thing I want to tell you, we're not going to make this real long today. Some of my programs have been going way over an hour. That muscle, when it gets shortened, that's going to lead to back problems. And I'm telling you, if you want to get well, listen to me. Don't listen to anyone else. Listen to me when it comes to this, because you can chase a back problem. You can chase herniated disc. You can chase bulging disc, disc degeneration, sacroiliac, piriformis syndrome. And if you don't address the psoas muscles, it's going to give you lots of problems. You need to make sure you really address it, because as that lordosis becomes more swayed in, that hyperlordosis, it's going to start compressing nerve roots and causing pain, sciatica going down the leg, and all those good things. So just moving on, we're almost done here, guys. Here's another stretch here. This is what I'm trying to explain. This is a simple one, bringing the body forward, really stretching that psoas muscle, particularly in that back thigh there, just opening up and really moving on that stretch. Here it is again from another angle. That's what we talked about earlier. Very, very important. Okay, and if you, almost done there. And then here we go on the other side. You can see that back leg really opening up, really, really stretching, really, really important. Now, guys, let me explain something to you, okay? We look at the psoas, and we look at, it's a very misled area because doctors overlook this. This is a very, very important structure. But one thing I want to tell you guys, very, very important, you must get up often while you're sitting. If you're sitting for long periods of time, you need to release this muscle. You need to walk around, change positions. This muscle will catch up with you. So what we'll do real quick, as I'm going to take just a few questions out here in our chat room, and hopefully we could just get through these questions, and we'll call it an early night. I just wanted to go ahead and bring this up to my listeners to give you a good understanding that a lot of people out there are walking around with these problems and are being misled. You need to really address that psoas muscle, because that is causing contraction, because you spend so much time driving, sitting, watching TV on the couch, sitting up on your bed. This muscle contracts, and it can cause that hyperlordosis in the lumbar spine, causing all that imbalance in the pelvic, particularly anterior pelvic tilt. And I invite everyone out there, Gothan, to make sure you check my video out on anterior pelvic tilt. It's probably one of the most comprehensive videos here on the internet. It's about 20 minutes or so, but it will show you all kinds of exercises. So go to my channel and go to my anterior pelvic tilt, and you're really going to learn a whole lot of information, and that will help you tremendously. Okay, let's take a few questions. I know you guys, we're filling up the chat room nicely. A couple questions. How long do I need to stretch this? You can stretch it every day, Sammy. Absolutely. Stretch it every day. Stretch it twice a day. But when you do a stretch, you should not have pain, just restriction and tension. Justin, after I crack my neck, it gets sore. We're not going to talk much about necks. You must stop cracking your neck. Raymond, the stress in the lower spine area, the hip area, cause neck pains, and are they related? Good question. Another person here, we talk about 62nd here. He talks about his feet, his flat feet. When you have feet that are flattened, or your arch falls down and you're pronated, and if your feet are coming inwards, you look at the outside of your heels. If you're wearing out the outside of your heels, that means you are pronated. By being pronated, it throws the Q angle off of the knee, causing the knee to come internally. When it comes internally, it throws the hip joint, throws the lower back off, and throws the neck. So yes, the question here is that when you have something going on down low, the pedal foundation states that whatever goes on below, above must follow. So yes, it is possible. Daphne, let's right above you. Sophie, let's say, what does it mean when a chiropractor puts a hand on small of the back of the spine and falls and hits the table? Hold on one second here. This is moving a little too quick here. 1 second for me. I'm trying to catch up here. Let's see. Feels like something is a blocking between my hip and my sacrum. What does it mean when a chiropractor puts his hand in the small of his back of your spine and the table while the neck section is still in the fist, like the two pieces. You're talking about drop work. Sometimes the tables drop. They call drop work, I believe you're talking about. Could this create sacral iliac pain where it feels like something is blocked in between my hip and my sacrum? Sacroiliac, just to show you guys, is one of the most common problems in lower back. This is where the sacrum here, if you look here, the sacrum in the middle here, and you have the iliums on the outside. You have two separate joints and they go side by side. So when the pelvic goes forward, what actually happens is it throws a leg length off, and they can work independently. With that type of condition, sacroiliac, you should not have pain in the sacroiliac. I really don't know the technique, exactly what he's doing. If he's using a drop work on you, the most important thing you may want to bring out to him is say, make sure my pelvic and my legs are aligned. So I don't know if he's adjusting a lumbar vertebrae or the sacroiliac. The sacroiliac can be adjusted on drop table. I preferably like to do a side posture manually. Just me, will you do or have already done a knee? We will eventually do something with the knee here. We just did something with the shoulder the other day. S-Oak trigger points for Psoas. Yes, if you can go in between the umbilicus, okay, I don't have the picture here, but if you can go in where your belly button is, I can show you on here. The belly button, let's say over here, okay, and the anterior superior iliac spine up in here, ASIS, in between the middle of it, if you push your fist in right in this area here, you're going to hit the psoas muscle. One of the techniques that we used to do quite often is that we take our fist and we push it straight in the abdomen, but when you do it, you take a deep breath, and as you blow your air out, like as you blow out, you go further in. And then take another deep breath, and as you blow it out, go further in. After about 3 of them, you're right on that psoas. So you can put pressure on that psoas muscle, and you can release it. Obviously, it's hard to tell, hard to teach you over the line, but that is something that can be done. Let's just take a few more questions, and then it's getting late. Let's see here. Gautam, you have a huge pain in your shoulder blades. You have to be a little more precise. Catherine, dock forward bending pose will stretch the psoas too. Generally, you have to get that back leg backwards. You have to really open that area up. Yes, there are certain yoga moves where you can bend off to the side and then use your other hand and touch next to your leg, and you bend off to the side. Yes, you can stretch that. And I had a picture in it. I did not post it. Yes, it can be done on side bending stretches as well. Yes, it can. Okay, just finishing up here. Big Trina, you get a lot of lower back pain. You feel a lot of pain when you walk too much, sitting for too long, and you get sharp pain in the morning. You can't really move first thing in the morning. Very common. People that can't get up and you have lots of problems when you first get up and you're very stiff, usually sacroiliac. Sacroiliac. That's the pelvic that's actually very contracted and tight. And once you get up and move around, things seems to ease up. You could do knee chest stretches in the morning. You could do piriformis stretches. You can look online. You know piriformis stretches, very good in the morning. And when you get up, just don't jump out of bed. Sit up. You may want to move your legs around a little bit. Move your hip flexors. Bring your knees up and down. Just get your area a little bit warmed up. Last question here. Scrapana books. Let's see. Could a 6-degree scoliosis in the lower lumbar spine also cause the psoas muscle to be shortened? I have this problem and my spine looks like the one you described. I doubt it. A lot of people have scolioses, and let's just tell you briefly. If you need to contact me, go to Motivational Doc on my Facebook. If you look from the front, this is a normal spine. If you see a curvature, then this is a scoliosis. 6 degrees is very minor. Basically, it's called a functional scoliosis. If you're right-handed and you're carrying things all day, you're carrying your purse on your right shoulder, you're lifting up your purse, you're carrying things all the time on one side, your computer, your body sometimes will compromise to that. I wouldn't worry so much about that. The best thing to do for scoliosis anyways is exercise, movement, keeping the weight down, building up core. Guys, you need to strengthen core. If you really want to have a nice strong back, you need to strengthen core. Do yourself that big favor. Last question here, Alvaro, California. Hello, my friend. Nuka technique. Nuka technique is obviously a toggle. They use that up on the upper cervical area. I did a lot of this when I originally was getting out of school many, many years ago. There are very few people that do it, but yeah, I think it's a very good technique and it can be very, very effective. Okay, guys, listen, we appreciate you. We're 20 minutes in, and I'm trying to shorten these programs. We've been going a little too long. You're going to see me up a lot. I'm going to try to get up here and really spend some time with you guys and throw some little programs out at you. I know I need to give you some notice, but sometimes I just come home. I say, you know what, in another hour I'm doing it. I'm an impulsive guy. And I hope that this will help you guys. Listen, I want to thank all you guys. I hope you enjoyed it. I ask you to share my videos. Feel free to contact me anytime. Best place is go to my Facebook, my motivational doc, my fan page, and I think that we'll share a lot of great information. It's been fun, guys, and thumbs up for all of you, okay? All right, God bless you. Have a great night.